I was diagnosed NMDA Encephalitis in July 2021.
I was just acting out of character or doing things that weren't quite me.
I had not seen any characteristics in her leading up to this. This was a quick onset, and so I knew there was something else wrong with her.
Constantly being in head pain, not knowing what was coming next.
She started just falling off in certain aspects.
I went and saw my doctor, said I got these headaches, and he sent me for an MRI. And he said, there's some white matter lesions on your brain, or we have no idea what this means.
Whatever I had to say, I had to basically fight to get it out.
She got you where?
I hurt.
In the hospital.
Restrained her multiple times.
It's not your fault. Okay, baby.
Why my daughter? What did she do to deserve any of this?
My name is Miko, and I am the mother of Shayla. I first noticed something was wrong with Shayla after I got a phone call from her sister stating that Shayla had been arrested. And I was like, arrested? That's really out of character for her.
I got a phone call from my oldest daughter. Shayla had attacked someone and was taken to jail. I first noticed something was wrong with Shayla when she was released from the jail.
After we picked her up from the jail, I noticed that she just wasn't herself. She was walking, and I could hear her walk because I can tell by the shuffle of her feet. And it happened to be raining that day. It was raining cats and dogs outside. And we were behind her. She didn't see me or her sister when she was walking out of the jail. And she had her hair done. She had her nails done. She had everything was done to the nines. And she walked out in the rain. And I called her name. And when she turned around, she just had this blank stare on her face, like she was in a trance, and was like, oh, hey, Mom. And I was like, well, something wrong. So then by that time, I was debating whether or not to take her to the ER. And so we ended up taking her to the ER, and she snapped at me. She literally snapped her finger, pointed and told me, hey, you keep your eyes on me. And I was like, what in the world is going on here? Because that's out of character. Like, who are you talking to?
Mama!
Shayla, I'm sitting right here.
Officer?
Shayla.
Mom?
I'm sitting right here.
I know that.
I'm sitting right here. They put her on a TDO status, which is called a temporary detention order in the state of Virginia. And she became a ward of the state. Now, she's an adult, so there's nothing I can do. And I'm like, okay, well, let me step back from being a nurse and just be her mother so we can figure out what's going on with her. So we went home, and later that night, I get a banging on the door. She has escaped the hospital. She showed up at my front door in the nightgown, in the hospital gown, and some flip-flops. And I see a car backing out of my driveway, and I'm like, oh my God, what are you doing here? She was like, Mom, I'm not crazy. Mom, I'm not crazy, I'm okay. I'm not staying in that hospital. And I was like, okay, Shay, just go ahead and go lay down. 10 minutes later, here come the police, coming to get her, to take her back to the hospital. I get a phone call that was over the weekend. I get a phone call Monday stating that her hearing, the judge dismissed her case and she's gonna be discharged. And I'm like, what the hell? That was a big waste of time to transport her from Hampton Roads all the way to Northern Virginia, and we still don't know what's wrong with her. I was like, well, what was the purpose of holding her for 3 days, transferring her 3 hours? You know, she a nervous wreck, she paranoid, she anxious. You transferred her 3 hours in the back of a squad car, and then just to turn around and release her, she could have came home. You know what today's date is? I'm not going nowhere. Oh, okay. Lay back. There you go. Good job. Okay.
Besides the pain, do you need anything else?
No, I think we're good. Thank you, though. Psychiatrist that worked at that particular facility was really good. She was really nice. And so me and her had a couple conversations about Shayla and medications and things that they were putting her on and what happened to her while she was there, because she had a reaction to a medication. Once we went and got her, I was just anxious and ready to bring her home, because they sent her to the mental hospital and nobody could tell me why.
When I was in the mental hospital, they just shot me with a bunch of stuff and kind of like doped me up.
It was either drug-induced psychosis or do we have any mental health in our family? Yeah, but who don't? Everybody got somebody in their family with a diagnosis. So they went and, in my personal opinion, were so quick to jump to that. Once they put that stigma of mental health on you, it pretty much almost, it followed her everywhere she went. Not even considering the fact that she was in a motor vehicle accident a week prior to, before all of this happened.
Oh, baby. Oh, Dad, please.
You already called your dad 3 times.
Is he hurt?
No, he's not hurt.
He's over here.
He's coming here.
Okay, so we're gonna do what?
I'm gonna give me some grapes. You're gonna sit on the floor
And do what?
relax.
Sometimes when I talk, people can't understand me. I talk too fast, or I talk slurred, or I talk weird, or I just don't talk regular.
So you don't remember smacking a nurse?
Let me see it.
No, I didn't videotape it. I just want to make sure that you know that you did smack the nurse.
For what though?
No reason whatsoever. You just saw one of the nurses, one of the white nurse that came in, a young lady that kept checking your vitals. For some reason, she was over there, and you looked at her, and I saw a look in your face, and you got out of the bed like you was about to attack her. So I grabbed you, stepped in front of you, and you kept saying the word bitch, over and over again. Shayla would stay up for multiple days at a time. We had to take shifts. It was me, her dad, and her sister. You what? You didn't get no sleep?
I need him.
You need some sleep. You gonna get some. You gonna get plenty of sleep. Yeah, see your grandparents with you? Take a little video to remind you. Normally I had the day shift. Her dad had the night shift, and her sister would pick up the evening after she got off work. Shayla would not sleep, and if she did sleep, it'd be in 20-minute intervals. If she got an hour, that was a miracle. But she would be up for days at a time, and none of the medications or anything was touching or helping her. I think the only thing that would really touch her was they would give her emergency Geodon and Ativan, and that would keep her down for 3 hours. Whereas a person like myself probably would be out for a full day. Can you pick your cup up with your hand? With Shayla, I just felt that they pretty much wrote her off as having some type of psychotic break. And so we're gonna, put her on all these medications and see which one of them calm her down. The involuntary spinning, I think it had happened around July 4th of July of 2021. Just when she had lost her speech. Before she could walk, she would spin 3 times in the floor, just turn around in the floor 3 times, and then she would walk. And then in laying in the bed, she would lay down and just spin constantly in the bed where somebody would have to grab her and stop her spinning, and she was like, I can't control it, I can't stop. What in the hell is wrong with her? We took her again to get her tested, labs drawn and everything, and they didn't find nothing wrong with her. And we come back home again. And then we did the footage, we did the filming, I will say, because I didn't believe that she was a schizophrenic.
Where are you?
What am I? What do you mean?
Fed? Are you a cult? Are you CSB? Or what are you?
I'm neither the above, none of the above.
Oh, okay.
What are you?
Shayla Braxton.
Are you fed, cult, or CSB?
At this point, I'm probably a fed baby.
You're what?
A fed baby.
A what?
A fed baby.
A fed baby?
Yes.
This is not a sign of schizophrenia. I'm like, everybody kept saying she's a schizophrenic. She had bipolar disease. And I'm like, no, this is not schizophrenia. Why is she spinning in the floor? Why is her speech, she talking normal, perfectly fine. And then all of a sudden, it's garbled. And then she has to hold her lips to try and talk normal. And I'm like, this is not schizophrenia. What in the hell is this? And I'm like, I know she having outbursts. I know she's psychotic at times. I know she hallucinating. But I'm like, this just happened. This is not nothing that was, over a year's time. This all happened in a week. Some of the hospital doctors were very good, and others were not. And one particular case, we had been going through this for about 6 weeks. And her last TDO, which is a temporary detention order in the state of Virginia, TDO'd her to the hospital. And I regret that to this day for her going to the mental hospital the second time. And I think that same afternoon, about 3 o'clock, I got a notification. And it was from her medical chart, her My Chart account, and it was like miscellaneous test. And I was like, well, what is this miscellaneous test? So I look it up, and within 20 minutes after I did my research, it was like NMDA receptor positive. And I was like, well, what is this? So I looked it up. In 20 minutes, every symptom, sign, and symptom she's had for the last 6 weeks was on there. So I'm in a rush, frantic to call the mental hospital. That was a 2-hour process because I couldn't talk to the psychiatrist. He wouldn't get on the phone. So it was me, the nurse, and she's relaying the messages to the psychiatrist. And I had to remind the psychiatrist that he is also a medical doctor, just to look at the test. And so when they finally do send her after midnight that same evening, I get there, and by the time I get to the hospital, she'd already been discharged. Unbeknownst to me, I didn't know she had been discharged. I had all these papers printed out, everything highlighted, like, look, this is what she has. The test was conducted here. The spinal tap was conducted here in this hospital. It's then come back positive. Everybody kept saying that she's a schizophrenic. She's not schizophrenic. And now we know what's wrong with her. So, I'm excited thinking that the ER doctor was going to treat her. And another brick wall was a no. He's not going to treat her. He's not going to admit her to the hospital. So I'm like, oh my God, what do I do? It was horrible because I thought at the end of the tunnel, I was excited thinking, oh my God, we're going to get some treatment. We're going to get some care. We know what's wrong with her after all this time trying to figure it out. And then he threw up a brick wall in my face and told me, no, I'm not going to treat you. Take your black ass home. That's the way I felt. That's just the way I felt. But I'm like, whatever. Huh? It's okay. It ain't your fault. It's okay. I mean, we laugh about it now. Because you don't remember, you don't know what you're doing. You can't control that. It's not your problem. And not only that, when they give you the steroids enhance it. You become the super incredible Shayla. Hawk Shay. Shay Hawk. You know what I'm saying? So it's not your fault. The doctors already know. You know what I'm saying? So it's okay, Pud. It's not major. You're going to be all right. Personal opinion, it was omission, neglect. You know what I'm saying? Patient care delay. And then a form of patient dumping because she was branded as having schizophrenia or a mental health condition. So we're not going to deal with this. This is what this is. It's so many doctors out of the 8 times that she went to the hospital in 6 weeks. It was so many people that just pretty much shrugged their shoulders. Oh, make an appointment with a psychiatrist, with mental health, follow up with mental health. Oh, she has schizophrenia. Even at the point when she had the written test diagnosis that said positive for NMDA, I still had to fight a doctor to get her treatment. What do you do in that situation? So I had a big issue with the hospital. And then later, to come to find out, once I go through all of her test results, when she initially had the spinal tap, she came back 98% leukocytes in her spinal fluid. So she had an infection going on in her body. And they sent her home and said, it looks like her diagnosis of schizophrenia is correct. And I'm like, okay, schizophrenia is chronic, long-term. Bits and pieces of signs will show as it progressively gets worse down the line before they become completely paranoid. I'm like, she did this in a week. She was perfectly fine the last time I talked to her. Maybe, let's rule out some stuff instead of just jumping to the easiest diagnosis there is. Leukocytes are white blood cells. And when you have an influx or a large amount of leukocytes in anything, whether it's in your blood or in your spinal fluid, that is a sign of an infection somewhere floating around in your body. So she had an infection going on in her body, and they sent her home and said, it looks like her diagnosis of schizophrenia is correct. But yet, I'm like, this big red H notification on her lab work that says that they're high. Nobody seemed to even catch that or look at that or notice that before she was discharged home. And so, I'm like, what is this about? How do you miss this? Well, schizophrenics shouldn't have leukocytes in their spinal fluid. So I had a huge issue with the hospital because it was almost to the point where you just dismissed her. Like she was, not even a factor to be even acknowledged or dealt with, because they assumed that she had a mental condition, when in fact she had a serious medical condition that needed to be treated. And the doctor refused to admit her. Refused. She ended up having a seizure on the gurney in the hallway of the ER that same night, and he still refused to admit her. He sees this and was like, oh, she's a schizophrenic. That's catatonia. That's normal in schizophrenics. And I'm standing there completely, my mind is blown. I'm like, are you serious? You have the test that says that this is what she has. You've admitted to me that you've treated this condition before, allegedly, but yet you don't seem to know what to do in this condition, so you're just gonna dismiss her. And so now, after all this time, trying to figure out what's wrong with her, I know what's wrong with her, and I still can't get no help. So that was a huge issue. That went home and I was like in a panic trying to figure out like how the hell I'm gonna get her, seen and treated, because he refused to admit her. He refused for another doctor. He said he's the only doctor there. He refused to transfer her to another hospital. He sent her back.
Hi, what you doing? I'm Jenna Braxton.
I don't know, boo.
Hey, doctor, nurse, whatever. Fuck y'all.
Hey, calm down.
They're not doctors. They're not nurses. They're trying to hurt me.
They're not gonna hurt you, boo.
Yes, they are. So wait.
Look at me. She was in the hospital back and forth maybe 8 times in 6 weeks. The one doctor that took the time to actually listen to what it is I was saying did the test. And they did the test and I didn't even know that they did the test. They were drawn for meningitis. And she added on the NMDA, I believe, probably in the midst of that, but I didn't know.
My mother is selfish.
Your mother is selfish.
She has to hospital.
She got you where?
Hospital.
In the hospital.
For what?
Huh?
For what?
For what? Why do you think you're here? Why do you think you're here?
You have done this to me.
I did this to you.
Yes.
I made you sick.
Yes.
Okay. So you think I should get a tiny house in the backyard? You gonna move in there? You gonna pay rent? What should I charge you?
That's up to you.
Is that to me? Okay. All right. You gonna still be cooking in my kitchen? My brand new renovated kitchen? Yes.
Stubborn.
I'm stubborn. I'm sorry. I am what the Lord made.
He is.
Yeah. Okay. So how you feeling now?
Mad.
Mad? At who?
You.
Why?
Because you are not a person.
I'm not a
Good person.
I'm not a good person?
No.
Well, I'm sorry you feel like that.
Okay, next time we're going.
Okay. So I'm a bad person?
Yes.
Why am I a bad person?
Hospital. I don't want to hit you.
Because you're in a hospital?
Yes.
Okay. She had a spinal tap June 25th. The test results did not come back until July 9th, I believe, that said that she was positive for this condition. The medication she received when she was there, she got steroid medication, she got plasmapheresis medication. She was on super high doses of antibiotics, vancomycin, Rocephin, doxycycline, all types of medications. And then when we got discharged, she still had to get rituximab infusions. The key thing with the rituximab is that it wipes out the immune system. She's supposed to get it like every 6 months. And initially, I think after her third trial of rituximab, her behavior started getting better. I was like, okay, she's starting to calm down. Everything is great. Her immune system is 0. But come September, the doctor thought she was relapsing because we had a couple episodes where her behavior was sporadic, that she tried to jump out of a moving vehicle twice. When we took her back to Philadelphia to be seen for her specialist, the doctors thought that it was signs of relapse. So we had to do another trial of the rituximab again. She gets her medication, she's able to get hers for free. She qualified for a program because she's as an adult. So she's able to get her medication for free through the manufacturer. But when we went, the rituximab copayment was gonna be like $3,000 for if we went through the insurance. But luckily, since she's, doesn't work anymore, she's able to get the medication for free. So you think once they get out of the hospital, they're gonna be better? No, not at all. It kicks up a notch when she got out of the hospital. Her behavior would be so erratic at times. You never know in the morning time what we were gonna get day to day.
I told God that I would not commit suicide again.
You're not gonna commit suicide. You're not gonna die, okay?
I don't want you to go nowhere either.
I'm not going nowhere. Her personality changed so much. She would be, one moment she a raging racist. Another moment she is, like a 6-year-old child. Another moment she wants to be the friendliest person on earth and she wants to shake everybody's hands and strangers and hug people. And I'm like, oh my God. So no, we can't do that. It was hard because, she's a grown woman, but what she wanted to do was unsafe and she didn't realize that. She couldn't comprehend that she's not back to normal. So the stuff that you may want to do as a grown woman, you can't do because Shayla's perceptions were off. Her peripheral vision was completely off. If you walked up to her and she wasn't expecting you, you would startle her, So, she wants to go back to her normal life. She wants to drive, she wants to work, she wants to hang out with her friends. And she couldn't do any of that. Not to mention she had no immune system. Her immune system was completely at 0. So we're like, you can't do certain things because if somebody sneezes, they might take you out. We can't have that.
I want to be with you for the next 2 months. That's all I want to be with you.
That's fine. It's me and you. Okay?
Okay. But I can't take a medicine though. It messes with me.
You gotta take the medicine until we see the doctor and get you something different, okay?
Okay.
Because if you don't take it, all hell gonna break loose. Okay?
All right.
Some days she would be perfectly fine. Other days she would be super violent. It was a bit rough.
I do remember beating the police up. I do remember getting into it with my mom, unwarranted. And she's the only person I remember fighting though.
Shayla has attacked me a few times. Punches to the face, curse words, threats. But it's out of her character, so I didn't take it to heart.
Tell him what he say it again. Okay. Tried to kill you.
You. Yeah, I'm not do that. I'm never ever gonna look at you. I love you too much.
You had a dream.
It's all a dream. It's a bad dream. Nightmare.
With Shayla, apparently she had been suffering from the condition. None of us knew. And then when she got in a motor vehicle accident and got hit in the face with the airbag, I believe it sped everything up.
I feel a 7 out of 10 in being normal. I don't think I'll ever feel normal.
I remember one time coming home from work, I think around like 8 or 9 p.m. when I was working at a hair salon, and driving down, I think it was School Drive, and looking to my right, and I was just seeing like apparitions of stuff. And I remember calling my husband at the time and told him, like, I'm seeing stuff. I think I'm really tired or stressed out. And he was like, what do you mean you're seeing stuff? And I just tried to explain as best as I could, but I kind of put it off as just being tired.
I was at work and I remember receiving a call from her husband at the time, letting me know that she had a seizure and that he was going to be taking her to the hospital for the seizure.
We actually met her husband and her and picked her up from a location in San Antonio after she was discharged.
I don't know what's wrong, Grandma. Something's wrong.
And your anxiety is making you feel that way, baby. Your anxiety levels are super high right now.
She was not feeling well, couldn't calm down, was crying, said something's wrong. She just kept crying that she couldn't breathe, that something was wrong and she was gonna die. So we called EMS and EMS came out and said, no, everything's fine. Vitals are okay. Just keep up with her medication that the hospital had prescribed her. And so we kind of held off on that medication, and that's when we took her to the second hospital because we weren't sure if it was actually the medication causing those symptoms or if it was something else.
Mama,
What, Melina?
I want to go to heaven.
Melina, we're not going to talk about that. We're not going to talk about that. You know why?
They said so.
Melina, that's Selena. Watch
I'm
Selena.
going to meet her. I'm going to heaven.
Melina.
I just remember being really scared to die or like pass away or anybody around me passing away.
Melina experienced headaches for about 2 weeks, and then one day she had a seizure right before I was going to work. She was taken to a local hospital where they gave her seizure medications and sent her home. She had a seizure on her way home, and then EMS transported her back to the hospital. From there, she was transported to another hospital. They monitored her for the weekend and then sent her back home after MRI was normal. She continued having hallucinations, insomnia, did not sleep well, was, aggravated, agitated, having anxiety. And so we sent her back to the same hospital where they said there was nothing else that they could do for her. Just monitor her, keep her on seizure medications, and follow up with a neurologist.
Cards for food.
Yes, Dad. Mommy, I know it's not y'all's fault. I didn't take my medicine. I was thinking of the devil.
It's okay,
I know
Mama.
we're scared.
It's okay. But
Okay?
we're gonna go get you help, okay? So
I'm being strong.
you are strong.
You are strong, baby.
And I'm gonna make it. Jesus
You
is
are.
with me. I'm gonna make it.
She continued on that night with the anxiety, the insomnia, hallucinations, speaking of, seeing faces and demons and the end of the world stuff.
Smiley, you did not love me my entire pregnancy. Smiley, you did not love me my entire pregnancy.
And so we sent her to a different hospital where they admitted her, and she stayed there for quite some time.
I don't remember anything about being sick.
The scariest thing I remember is being in the hospital, and I went to go take a break. And I came back and I found my wife, kind of hysterical. And I go, what's going on? Well, they just put a code blue out of Melina's room. And so I immediately took off over there. And when I got there, they were attempting to resuscitate her. And, I held it together, but I had to walk out of the room because I didn't know what was going to happen. And, the staff was telling me I needed to wait. That was the scariest part of everything that went on.
Track that. Move this way, then.
Over here. Right? There you go, mama.
Again.
Oh, my sweetheart. Oh, my darling.
When she was there for 88 days, I was there for 78, Sunday through Monday, 8 a.m. to 8 p.m. She couldn't swallow on her own. So she was constantly full of drool. She was constantly full of her own saliva. And if somebody wasn't there on her, that was, she wasn't able to swallow that. And she developed pneumonia while she was in there, I want to say a couple of times. And, so I was like, I'm going to stay there. I'm going to do this. I'm going to make sure that she's getting the care she needs. I don't care if I don't get any sleep. I remember a couple of times I even stayed overnight and I would stay with her all through the night, It's just, I didn't want to leave her side. Because of what she went through, I know she had some injuries to her frontal lobe. So, she had her moments where she would get pretty moody when she did go through her, violent phase, I guess. It was mainly in the hospital.
I need Lily! I need Lily! Give me my fucking phone!
Melina.
Somebody let me talk to Lily!
They did have to restrain her multiple times because of the injury to her brain. A lot of patients who have traumatic brain injuries are violent and uncontrollable.
Staff would tell us that she was, resisting the medication. She was wanting to get up. She was wanting to leave the hospital. She was constantly looking for her son. I remember when she first started coming back around, when she first started to wake up after everything was going on, I took her blanket, we took her blanket, a baby blanket, and it still smelled like her son. So her in recovery and still not knowing, I remember her grabbing the blanket, bundling it up, and then holding it as if she still had her child with her, and she was rocking her baby, not knowing that she was actually rocking her baby.
She still knows how to cuss.
Oh, she's cussing. I see that. Okay. I told you. That's what she's saying.
And so I did my own research because initially they said she was postpartum psychosis. She was having anxiety, depression. So they were giving her medication for psychosis, antidepressants, things like that. And so I knew that was not my daughter. You just know your children, and you know when they're experiencing something that's not mentally related. This I knew was medically related somehow.
Does she know what's going on with her?
Before, when we first came in, she did.
Okay.
And so in my research, I came across another survivor story, which I saw on a TV show. And so I reached out to that survivor, and she told me to make sure to check Melina's ovaries to see if she had an ovarian teratoma, which is linked to NMDA encephalitis. This wasn't something mental. I knew this was something medical because I had not seen any characteristics in her leading up to this as far as depression, anxiety, things like that. This was a quick onset, and so I knew there was something else wrong with her. A lot of the doctors did not care to listen. Few did. One in particular told me, if you want to play doctor, show me the proof. And so in my research, I showed him the proof regarding ovarian cysts linked to NMDAR. And so after that, that's when we noticed that some of the providers were actually interested in finding out what this was and what the cause was.
They found out that there was brain tissue in that
teratoma.
Mm-hmm. And that's exactly what the survivor told me happened to her. And I'm glad I pushed for it because they excluded it and said it was normal.
Yeah.
And so in my research, I found that Melina did have a cyst, which was shown in the studies when she initially was hospitalized. But doctors assumed that it was a normal cyst and it was not related. Finally, one doctor agreed to do a spinal tap test. And so the spinal tap test that he did came back negative for any antibodies, but they weren't testing specifically for NMDA. And so when we brought up the cyst again, they sent a second spinal tap serum to Mayo Clinic in Houston, where it came back positive for NMDA. So they were treating the diagnosis of NMDA with plasmapheresis, with IVIG, and with chemotherapy. She continued on with the insomnia, with the dyskinesias, the motor movements of her mouth, uncontrollable, autonomic dyskinesias. She also had seizure-like activity, which weren't seizures, and so they kept continuing to give her seizure medications. But all of that was contributed to this cyst. The host was the cyst, and that was what needed to be removed to help her condition. Her cyst contained neurotissue, spinal tissue, and eyeball tissue. And so her body detected it as a foreign object and was creating antibodies to fight the cyst, which then created the NMDA antibodies. Melina received chemotherapy, and her hair, of course, was falling out because of the chemo. But being hospitalized over a long period of time, her hair became matted. And so I had to cut her hair. And it just, after that, just all fell out due to the chemotherapy. Her hair eventually did grow back after I made a recipe of different oils for her hair growth, and it took her time to wear the wigs. She wasn't comfortable with wearing them, but eventually it grew on her, and now her hair's back to where it was, and it's curlier than what it was, but that was a struggle for everyone. So with her recovery, she had speech therapy and physical therapy. She was in therapy for about 2 months after hospital discharge.
Right foot black, right foot green, left foot blue, left foot red.
She was not able to walk. She lost about 50 pounds in the hospital. So when Melina returned home from the hospital, her behavior changed. She went from being a 21-year-old to, I would say, a 2-year-old.
What's wrong, babe?
I don't like it.
You tired? Pastilla?
My favorite. I love you, Mom.
Love you.
I love you, Mom.
I love
You're
you.
my favorite. You're my favorite, Mom. Dad, you're my favorite. I love you.
I love you, baby.
You're my favorite, Dad. You're my favorite. I love you,
loves you
Dad.
very much.
I love you, Dad.
I love you, baby.
Where are we
girl.
going?
Love you.
Where are we going?
We're gonna go to your appointment, your checkups.
Why?
Because you need your checkups.
I want to be normal.
Well, that's why we're going to your
I
checkups.
want to be normal. I don't like it. I don't feel real. I don't
know.
like it.
I know.
I don't like it. I want to be normal.
Did we bring her mask?
I want to be normal. I don't like it. I want to be normal. I don't like it. I want to be normal now.
She didn't know her name, didn't know who we were. She said she felt like everything was unreal around her. There were moments where she had derealization and would just scream that this wasn't real. Where am I? Who are you? This isn't our home. Why is my baby 7 months old? He was 3 months old when I fell asleep. And so the loss of time kind of really affected her emotions and her thought process. She had to relearn how to write her name, how to say her ABCs, didn't know her colors. I bought her flashcards in the hospital, and I would, just teach her the basics all over again. She lost perception of everything. She was like a toddler all over again that we had to retrain.
She had a lot going against her as far as, where's my son? Where's my husband? How come they're not here? How come, where did they go? Were they in the hospital with me? So she was dealing with the injury to her frontal lobe on top of the emotional injury of, at the time she didn't realize, but she was being left. It didn't just affect her, it affected all of us. I never thought about it before, but it's safe to say that each of us came out with some form of PTSD, some form of anxiety, some form of stress, a lot of anger, a lot of hurt. Her illness has brought me a lot closer to God. It's brought me a lot closer to my family. I was close before, but this has definitely changed who I was into who I am today.
Melina, she did speak of suicide often. A lot of times she felt like, why am I suffering Why am I here? You know, my husband's left. Everything's changed. I feel different. I'm not who I am. You know, nobody understands what it feels like to be me. I'm not the same person inside. You know, how could this happen to me?
From the beginning, through the middle, all the way to the end, you know, once she realized, you know, when she started accepting that she was losing her family and, you know, her friends were abandoning her, she just like, you know, nobody loves me, you know, it's not my fault I went through this, you know, I can't control. How come nobody can understand that this is not me, this is not who I am? She never physically attempted suicide, but she did talk about, you know, not wanting to suffer, not wanting to go through this. She was very scared.
I still do have like PTSD over a lot of things, even though I don't remember the hospital. I don't feel 100% back to myself. I don't think I'll ever be 100% back to myself.
I'm Matthew Park. We're here to discuss Erin's autoimmune disorder, encephalitis. It's weird. Time frames are incredibly elastic between both of our storylines in this. Everything that seemed to be going wrong just seemed isolated up until the moment where I started calling around and saying, hey, is Erin acting weird to you? I called her teacher friends, I called your mom, I called your close friends, and I got independent verification that said, hey, you know, I was gonna ask you about that. Like, Erin did X, Y, and Z, and I don't know why. And I go the same thing. I'm like, this is just completely weird. I mean, it was just a negligence I have never witnessed with her ever.
I don't know when the definitive beginning is. We had gotten into some argument. He kept telling me that I was being unreasonable about things, but I didn't think I was being unreasonable about things. And I didn't know. I didn't see anything that I had done that was wrong. Shortly after that, I had signed up to chaperone a field trip, and I just had the worst migraine the whole time, and I just felt all out of sorts. And the other teacher I was with, I finally said, when we got to FGCU, I said, I can't get off the bus, I can't do anything. I need to stay on the bus. I can't move, I can't walk, like I feel like I'm gonna die. And I was there for several hours while they went and toured the campus, they had lunch, the whole thing, and by the time I got back, I just still had a headache. I'd thrown up a couple times just from how much pain I was. And that's the only thing I remember from that trip. And when I got home, and I just did not feel, I still didn't feel good. It became enough of an issue that, and the headaches were bad, and I was acting strange, so I decided that I was gonna go see my general practitioner. So I went and saw my doctor, said I got these headaches, and he sent me for an MRI. Got the MRI results back. I remember he called me and he said, got your results back. There's some white matter lesions on your brain. And he said, but because you've never had an MRI before, you've never had any kind of brain imaging before, we have no idea what this means. It could mean nothing. It could just mean that you have a history of migraines, which I did. It could be something worse. It could be nothing. We don't know. We're just gonna have to keep an eye on it.
When Erin was not gonna prepare an actual meal for Bronwyn, she's never shown any sort of this behavior to our daughter.
And that was the first time I think he really thought that something was totally out of character.
When Erin lost the ability to be a mother, like the best mother that she's always been, that's when I had to say, stop. That's it, done. I called Erin's general practitioner, and that's when he said, this sounds very serious. You need to take her to the ER. So I pack her up. I pack Bronwyn up. We drive the 5 blocks to the hospital just to the north of us and go to the ER. We're sitting, waiting for admittance into the ER. You know, it's a crowded lobby. Erin's, again, not being attentive. She's kind of staring off into space, just not present. 6:30, 7 o'clock the same night. We're in the ER. We finally get admitted. So we wait around a couple hours. And it was a matter of 5 minutes of her being left alone. For me to take my daughter to the parking garage, hand her off. My mom leaves the parking garage. I get a call no later than 1 minute after I hand my daughter off. It's the attending physician. He's like, "Hey, is this Matthew Park?" "Yes." I'm like, "Hi." He's like, "Do you know where your wife is?" And that is the scariest moment of my life. I have never been more terrified. I was like, "What do you mean, where is my wife?" She's like, "She's no longer in the emergency room. She's gone."
To me, I thought I was perfectly fine. So they had the bag of my stuff in the room, and I was like, well, there are my clothes, there's my purse. I'm just gonna put on my clothes and get my purse, and I'm gonna walk out, because it was just down the street from our house. It's less than a mile. I was like, I can walk home, it's no problem. So I put on my clothes, I go outside, and as I'm leaving the hospital, the guards that were standing out front of the hospital stopped me, and they said, "Hey, where are you going?" I said, "I'm going home." They said, "Do you know where you're going?" I said, "Yeah." And they said, "Okay." And they let me walk. And I had my little hospital bracelet still on and everything. But at some point, I got turned around. And I didn't know where I was. I couldn't find my phone in my purse. I didn't know where that was. But for some reason, looking at the street signs made no sense to me. So I decided that the train tracks would lead me somewhere if I followed the train tracks. So I started wandering along the train tracks. And I was stopped by a homeless man who asked me what I was doing out there. And I told him, "Oh, I'm trying to get home." He said, "You probably shouldn't be out here." And I said, "Okay." And then I just went on my merry way.
I had no idea where she was in this town. She could have been picked up. We had the police looking out for her. We had it was just me. And about after an hour, it seemed like forever. I get a call from the police, and they said, "Hey, we think we found your wife." I pull up, and it's like a scene out of Cops. You know, I've got 3 police cars with lights on, flashing. She's just looking like she was just like she escaped from somewhere, just dazed look in her eye, just not there at all. Everything else didn't matter at that point. I was like, okay, something's wrong. This definitely confirmed it. And the police are still there, they're conversing amongst us. I'm like, please, I need your help. Please just at least accompany us back to the hospital.
And at that point, I lost it, because that was the last place I wanted to be. I did not want to be in the hospital. So I started yelling and screaming, and he pulled into the hospital parking lot, and I refused to get out of the car. Absolutely refused. And so one of the police officers, a female police officer, came over, and I don't know what she said to me other than it worked. So she calmed me down and got me to go back into the hospital. And at that point, it was obvious to the hospital staff, I think, that this might be a psychological issue.
At this point, the attending physician knew we can't let this person walk away, and so they Baker acted her right there. She was still exhibiting psychological issues, not being responsive, aphasia, just stuff that wasn't, obviously in character for her. But they couldn't find a medical reason for it. So they admitted, I remember clear as day is this, the neurologist saying, "Hey, we don't know what's going on. We don't think this is a medical issue. We're gonna have to admit her to the psychiatric ward."
Most of my memories are very spotty, and the ones that I do have, I don't necessarily trust as far as the veracity of them, but there are like bits and pieces that I remember. I remember that the psychiatrist who was assigned to me, she just didn't seem that convinced that I had my wits together, which I didn't at that point, to be fair, but she just was, she thought it was a psychological issue. She had the added complication of she was about to get married and go on her honeymoon, so she was ready to unload her caseload to somebody else who was coming in. And I just remember not at that point, not even questioning why I was there. It was just like, this is where you are now, like a kind of like ambivalence almost. But that's where I started to have a lot of physical problems. Like I was having trouble walking. I did not bathe myself at all. Because the bathrooms in the psych ward did not have showers in the bedroom units, so you had to go somewhere else for a shower, and I was too afraid to ask somebody for help and to ask somebody if I could take a shower. So when my parents and my family came to visit me one time, they just noticed that like my hair was all matted and I hadn't bathed and I probably hadn't changed my clothes, and they were like, "What is happening here? Like this is terrifying." So they got me to take a shower, and I just remember, after I got out of the shower, I could not get off the floor. Like I was sitting on the floor and I could not get off, and I kept yelling for help. And it felt like I was in there for like a half an hour, just screaming for somebody to come help me because I could not stand up. I could not stand up. I could not get my clothes back on. Like, and there's nothing more vulnerable than like being naked on the floor somewhere and you can't move and nobody's there to help you. So that was probably the scariest moment that I can remember.
And so we're talking about the span of 2.5 weeks. And by that time, we're like, in early February, I had put the call out to her internet community saying, "Hey, what are we doing? This is what's going on. Can somebody please help crowdsource an answer?" And I got it. I read the book. Certain things just jumped out at me. I'm like, this happened, this happened, this happened. I tell the neurologist, "Hey, do you know this? Have you ever heard of this?" He's like, "Yeah, but that's not it. It's not gonna be a crazy," yeah, and he said, "We don't chase zebras here." It's just such a crazy diagnosis. The statistics for her having it are so rare that it has no possibility to be that. And I was like, what the hell does that mean?
I was having trouble just getting my limbs to all go in the same place at the same time. I just remember, a lot of like sitting in the common room with all the other patients and like playing games with all the other patients. And I still was not really aware of what was going on and what was happening. Apparently one night I started banging on the door, screaming for help or screaming for somebody. And when they came in, they found that my blood pressure was like through the roof. And once they had done more testing, they found out that I had thrown 2 pulmonary embolisms while I was in there. So at that point, that was when they realized that, well, we don't know what the psychological symptoms are, but like there's clearly something physical happening here. So we're not going to pull her out of the psych ward and take her to a different part of the hospital. And we're treating it as a physical thing now.
And she had her ultimate moment where she was banging on the door and it got, the attention. It finally got people's attention. It got her GP's attention, who wasn't her attending physician for this, but he looked at her, file and said, her levels are X, Y, and Z. These are way out of whack. And that's what made turn. And then she threw the pulmonary embolisms. And then that's when it became less a psychiatric issue and became a full-blown medical issue.
I agreed to do this documentary because it needs to be highlighted. Even though we had such a hard time in the hospital with a particular doctor and getting her care, it's going to be patients in the hospital pretty much as we speak right now. Patients today that are in the hospital. It's going to be a patient tomorrow. It's going to be a patient next week and next year with the same exact condition.
So they tried to just write her off. Schizophrenic, bipolar, and Shayla was none of that.
They had done all these tests. They had given me CAT scans, more MRIs, all this stuff. And my dad's friend, who was the neurologist down there, he said, I don't know what's wrong with her and I can't figure it out.
A lot of doctors were just quick to diagnose her with postpartum psychosis. She had just given birth to her son, who was 3 months old at the time. They said she's young, in nursing school, new mom, husband was in the military. She's just dealing with a lot. And this is the result of stress and postpartum psychosis.
I knew in the back of my mind that something was going on mentally. You had your initial MRI, we got the results in, and it showed a small amount of just gray matter, just anomalous enough that's going to warrant further testing.
It wasn't until like 2 or 3 weeks, like a couple days after I came home, like permanently after all of this was over, that we got the official diagnosis, like the test results have finally come back and it's an NMDA. But before that, when they had just suspected that it might be that, they'd scanned my ovaries, they'd scanned everything looking for something that could be it, and they had scanned every part of my body and there was nothing there.
I'm sleeping. I'm breathing. Y'all is too. So what's happening?
Now anybody I look at that has any type of abnormal behavior, it makes me wonder if this is actually a mental health disorder or if it's something else wrong with them. It's like everybody now, I want to send them to get a full workup, completely, inside and out. Do a full workup, spinal taps, blood work, everything. So it makes me more cautious. And not only that, it makes me a little bit more overprotective.
Sometimes it's hard to control my emotions, my memory. My memory is not all the way there. I can remember some things sometimes. I get tired kind of quickly now with doing stuff. No matter what it is, for I'll get tired and just winded. I can't cuss people out like I used to. That took something from me. I can't cuss anymore like I used to.
One thing about this condition I learned, you gotta be very patient. This condition takes so much patience. If I haven't learned anything, I have learned to be patient. Because this is not no easy process. It's not no rush through process. This is a long, drawn out process, roller coaster. Once you figure out and you get the diagnosis, the roller coaster ride slows down, but it doesn't stop. So it's like, you have to figure out everything day to day.
She's coming. This is immediately following the dose of medication, only a half dose.
I'm gonna die.
You're not gonna die, baby.
That's why you're recording me.
No, baby.
No.
That's just talking.
This disease is life-changing for sure. It affects not just the survivor, but the whole family. And it takes a lot to come through together, work together, have patience, and to be there for the survivor. They depend on us for their care. They depend on us for their support because they have no one else.
It taught me that just when somebody you love is in that situation, you will do whatever it takes to get them out of it. Because I knew she was in there. I always knew. I never lost faith that she was gone. I knew that she was in there somewhere and we were gonna get her back. And that's what drove me.
And we rolling into our second year. So she getting better. She getting better. She not there yet, but she getting better. Hey, you look good this morning.
I do, huh?
You do.
If it can help the next person understand what's going on in their mind, if they know something's not right with them, I feel like there's a lot of people who might be going through what I'm going through and don't necessarily get the same help that I get because mom's a nurse. There's a lot of people in the world that may need help.
We have to advocate for them. We have to be their voice. This disease is not as rare as we think. This disease, I believe, is misdiagnosed most times as other things such as schizophrenia, as postpartum, as anxiety, as depression. And so my belief is that there are many patients that could be sitting in a mental hospital undiagnosed that may have this condition. And in speaking about it, we can help others to fight and others to help determine what's wrong.
If this can help one person, if one family doesn't have to sit around for over a month, 2 months, waiting for answers, they can see, okay, this is a firsthand experience from an encephalitis patient, and I have a patient that's experiencing something similar. Maybe I should look into this more.
Do not give up. You're going to be tested until you think you can be tested no more. You pick up your cross every day, and you're going to have to pick up the cross of your loved one, and you can get them to the end, and it's going to feel like you can't. It's going to feel like you're drowning, and you can't breathe anymore. But get up, keep going. There is a light at the end of the tunnel. Your loved one will get better.